So I would come to palpating on the symphysis. Is that okay?
Yes.
And there's a spot that's actually dense. And so I look at the patient and I say, I can feel that dense. Is that painful for you?
It's a bit tender.
It's a bit tender. Yeah. So that may be something that I might want to treat. In the end, I won't treat all the densifications that I find, but I'll choose 6 to 10, if there are that many, that are the most dense. So I wouldn't necessarily, otherwise I could treat as I go along and assess, but I would assess everything first and then choose 6 to 10 to treat. So I palpate along there, and then we would come to the xiphoid, or the area around the xiphoid. Is that okay?
Yes, of course.
So I'm just going to palpate the tissues against your ribs. And so we want to glide the superficial fascia against the deep fascia. So we need a certain amount of pressure in order to do that. Oh, and there's another spot of those. Yes?
Yeah. Yeah.
Is that okay? So which correlates a little bit to her arm lifting, that she had more trouble lifting. There was a hesitancy in lifting one arm more than the other, and so there's this densification, and so that might literally pull the pectoralis fascia down, which gives her that delay. So she then came and said, my shoulder hurts because I carry my baby so much. It may well be that we need to release this in order to give the shoulder better movement.
Could that have been caused by carrying the baby there?
That's less likely.
Right.
Everything's possible, but in that sense, it's more likely that that was the pregnancy that set up this densification. Okay, and then we would have a look at you lying on your front, please. So you can just, are your arms comfortable like that? Right, I'm just going to palpate your muscles of your back. Is that okay?
Yeah.
I have, by the way, written up this sequence in a notes sheet that I think you said you were going to.
Yes, I'll send out an email tomorrow with the slides and any other handouts or references that you give us.
If anybody's interested in incorporating that in their practice, they can. I often use a sensory and a motor hand so that I can perceive that better. And now I'm going to just palpate over the iliac crest. And there's another one of those spots. Very painful? Medium. Okay. So they are, my mentor Renzo would always call that exquisite. They cause an exquisite sensation. Yes. So, and I'd look at all vectors. So I look at, once I've found a densification, I'll check it for, it's like going, if it had corners, I'd check all the corners of it. Yeah, I'd move into all these vectors.
Yeah.
So we do it there as well. And then you could go, depending on the there's another one. Yeah, so they are probably clinically relevant. You could go down the thoracolumbar fascia all the way over the sacrum to the coccyx, depending on what the rest of the case history gives you.